Hello and welcome to the third in our series of basic Pilates principles. Today we are looking at the pelvic floor. So the pelvic floor sits at the bottom of our core. So it acts like a bit of a sling. It's a group of muscles that sits from all the way from your pubic bone round to your tailbone and supports the bottom of your pelvis here. So as many of us may know, really important for bladder and bowel control. Yes, men, you do have a pelvic floor, and it is just as important for you guys to work it as well. So a common misconception with the pelvic floor is that we need to be contracting and engaging it as often as we can. Now, yes, that is a really good thing to do, but what often gets forgotten is to relax the pelvic floor. So we want to talk about today how the pelvic floor works with your breath. So in the session 2 we were talking about diaphragmatic breathing, and I did mention how important that is in relation to activating your pelvic floor. So today we'll talk about that a little bit to make sure you get a clear understanding of how and why you should be engaging and relaxing the pelvic floor. So as we mentioned in the diaphragmatic breathing session, the diaphragm sits here. When we breathe in, it drops down. When we breathe out, it comes back up again. So the diaphragm is sitting here, and the pelvic floor is sitting like a sling from the pubic bone round to your backside. So if you think of the core like a cylinder, you've got the diaphragm at the top and the pelvic floor at the bottom. We then have your transverse abs, which sit at the front, and multifidus, which sits at the back. Okay, but don't worry about those two at the moment. We'll talk about them further down the line. But we're just focusing on the top and the bottom and how they work together. Okay, so the diaphragm's sitting here, like I said, and the pelvic floor's sitting here. It's really supporting the bottom of the pelvis. Everything kind of round there is muscle. So when we breathe in, that diaphragm's going to move down, like we said. Your belly's going to inflate. So it's going to be really difficult to push up with the pelvic floor there, because that air is pressing down into the belly. So actually what we want when we breathe in is that pelvic floor to relax. Then as you breathe out, that pelvic floor can lift up as all that air expels out of your body. Okay, so that's how they work in conjunction with each other. They move together. Okay, a lot of people that I see come to me and they're trying to engage the pelvic floor on an in-breath, and they're almost sucking everything up and breathing from up here too much. So it shouldn't feel like it's a lot of work. It should feel quite relaxed and quite comfortable, and that you can get into quite a nice rhythm with it. So we're going to have a little go at engaging and relaxing the pelvic floor with your breath. But first, I need to make sure you know how to engage the pelvic floor. A lot of people will just say, yeah, I know how, but not actually be doing it correctly. So there's a few little different cues you can think about. So when you're engaging the pelvic floor, you're kind of engaging from all the way from your back passage slowly forward. So if you think about that little sling muscle, so it's in a little shape all the way around here, and think about it lifting up from the back passage forwards. So one way that we do that in everyday life is if you were to stop yourself mid-flow, if you're a woman, or stopping yourself from farting, or one really funny analogy that someone told me is thinking about sucking up a thick milkshake through a straw. Okay. And when we're going through our Pilates exercises, often I see people trying to engage it too much that they start recruiting in bottom muscles, inner thighs, tensing all these superficial muscles. It only needs to be a nice subtle lift. So let's think about 40 to 50% lift for the moment. So we're going to have a lie down on your back, and you can try through those different analogies to see what works for you. So we're coming to our Pilates rest position, so what we went through in session 1. So finding that nice rest position, your neutral spine, length through the back of the neck, wide through the chest. And then we'll start with that diaphragmatic breathing that we went through in session 2. So bring the middle fingers together, place them onto your belly. Think about that balloon in the stomach. And we'll inhale, inflate that balloon. Feel those middle fingers come apart. And exhale, deflate the balloon. Feel the middle fingers gently touch. Inhale, inflate. So we're just focusing on the breath first, because as we talked about, that's incredibly important to have correct. If we don't have this diaphragmatic breathing, it's going to be really, really difficult to try and engage and relax the pelvic floor. So once you feel you've got the rhythm of your breath, we'll take a breath into the belly. Then as you exhale, think about that gentle lift from your backside all the way forwards, lifting up and almost squeezing that air out your body. And inhale, feel that air come down, expand that balloon, and see if you can just let that pelvic floor relax. So exhale, we engage. So think about stopping yourself mid-flow, stopping yourself from farting. Inhale, we release. Exhale, just a little lift. If you have your hands on your tummies, you shouldn't feel a real tense here as you engage that pelvic floor. You should just be feeling it inside. Just getting used to this rhythm. Now this might feel quite unusual for you. It might be something you're quite used to, but either way it's really good to come back and practice this. So if you feel you've got the hang of this, same like we did in session 2, if you come up into a seated position and see if we can do that again in seated or standing, whatever feels comfortable for you. So either on the floor or sitting on a chair, sofa, bed. Bring the hands again, middle fingertips touching. Inhale, inflate the belly. And exhale, just feel that gentle little lift. Inhale, inflate and release that pelvic floor. And exhale, feel that gentle little lift. And inhale. And exhale. Just get used to this rhythm. When you're first learning this, it's really good to give yourself time, maybe go somewhere quiet, somewhere you won't be disturbed, close your eyes, and just get used to this rhythm with the pelvic floor and the diaphragm. It can take a lot of concentration and can also be quite relaxing and calming for the mind. So if you feel you've got the hang of this in a seated or standing position, we're going to practice with some holds with the pelvic floor. A lot of people then get confused when we're telling you to hold the pelvic floor but keep breathing, of how you are meant to breathe. So as we were talking about, when you breathe into your belly expands and that pelvic floor will relax. How do you keep that contraction against that belly breathing in? So what we tend to do when we then hold the pelvic floor is think about breathing more laterally. So then what I will get you to do, we'll start this lying down but placing your hands onto the outsides of your rib cage. So lying down is always the best position to start these exercises. So bring the hands to the outside of the rib cage. We'll take a breath into your belly to start. And then exhale, find that engagement. So gentle lift up from the back passage forwards. And see if you can hold it there. And breathing almost into your armpits, so right into the side of the lungs. But keeping that pelvic floor engaged. So you should feel that rib cage pressing out against your hands as you breathe. And just see how many breaths you can do here. And then on a breath out, just release and let it go. Sometimes people really struggle to release that pelvic floor on an in-breath. So you can always take an extra out-breath to let that pelvic floor release. Okay? So don't feel like you have to stick to this rhythm. You have to breathe out to engage the pelvic floor, but you can release on an in-breath or an out-breath. So let's try that hold again. So breath into the belly. Then exhale, find that gentle lift. Holding that lift and breathing into the outside of the rib cage. So feeling those lungs coming out to the side, pressing against your hands. And just see how many breaths you can do. It might only be 1 or 2, that's fine. Just slowly build yourself up. And then exhale to completely release, completely let go of that pelvic floor. If you feel you've got the hang of this, then we'll try it in a seated position. So important to make sure you're releasing that pelvic floor as well as engaging it. A tight pelvic floor, it actually inserts into around the hips and connects in with the lower back. If you suffer from hip pain or back pain, particularly after childbirth, however many years ago that was, it can be related to tightness in your pelvic floor. And the pelvic floor is a muscle, so much like any muscle, if it's tight, it's going to be weak. If you look at my bicep, if I contract the bicep all the way, and then you ask me to contract this bicep, I can a little bit, but it's not very strong. But if I actually relax the bicep and then contract it all the way, I can get a much, much better contraction. So it works the same with the pelvic floor. That's why we talk about it so important to release as well as contract. So we're going to try that same exercise in sitting or standing. Middle fingers touch, hands onto the belly. Find that breath into your belly first. So finding that diaphragm working. Then bring the hands onto the outside of the rib cage. Breath into your belly. Breath out, find that gentle lift. Then holding it here and breathing into the rib cage. So feeling the lungs expand out to the sides. Doing as many breaths as you can. Then on that out breath, completely relax that pelvic floor, let it go. If you need an extra out breath, let it go again. If you feel you're still holding on to tension, perhaps you're lifting and engaging too much, that you're recruiting in your superficial muscles, so just lifting a little bit lower with that pelvic floor. And I want you to continue practicing these exercises, picking what feels right for you at the moment. You might just feel that breathing in and out and engaging, relaxing the pelvic floor is enough for you right now. Or you might want to give a go at some of the holds as well. Have a little play around with it, and we look forward to seeing you in some of our Pilates classes, practicing those same exercises with movement of the body. Thank you for joining us today. We'll see you again for session 4.